Hi there, my name is Lisa Adkins, and I am here to present my speech number 3, Understanding Your Communication Presentation. I will be listing the 3 of my favorite questions as part of the speech. Number 1, in terms of communicating, listening, understanding, what is something you wish your family better understood or had understood about you? I shared that I have a busy schedule as an older adult and going back to school, raising a family, and working full-time on night shift. I constantly feel rushed, and at times I feel as if I can hear the second hand ticking away on a stopwatch. And I wish that I was better able to communicate my feelings appropriately to my children. Sometimes I'm running out the door to go to work, and at the same time, I'm reminding them, you got to do this, and you got to do that, and you got to do your homework, you got to take a shower. And then when I come back in the morning to pick them up and take them to school, I've oftentimes forgotten to greet them, say hello, how are you doing? And instead, I've asked them, did you brush your teeth? Did you get your homework done? Have you taken your shower? And I don't want my children to look back on their childhood and think about how demanding I was to them, or negative. I don't want my comments to seem negative. I want them to know that I'm going back to school to better our family financially, and me as a nurse helping more patients and being better able to understand their needs. And then it's not to cause them extra stress. And I want them to do their best in school. And I want them to complete their homework so that they can study hard for a test. My next question was on number 2. In terms of communicating, listening, understanding, what is something you wish that your friends or significant other better understood about you? I shared that I work on a rehab unit as a nurse, and part of my job is to educate the patients on what actions they were doing at home that were not beneficial to their health, or what is limiting them for their strength, getting them back in shape. And one time I had to talk to a patient about his behavior, how his behavior was limiting his success, because he required staff assistance with a Hoyer machine to physically pick him up in a net and to reposition him into a chair. He would use this as an excuse to not do normal activities like sitting on a commode to go to the bathroom. And the way I spoke with the patient offended him, and he asked that I not come back into his room. And I wish that he would realize that my motives were pure and that I was looking out for his best interest, and I was going to actively participate in getting him in the machine, to transfer him into a chair, to promote activities that are going to help him succeed when he goes home, and not giving him an easy out to not get up and sit in a chair. And then my next thought was, what is a compliment that you have received that changed your life, or at least is a memorable compliment? And I would say that it was when I had asked my clinical educator at work to submit a reference form for me to apply for a scholarship to ICC. It was a big jump for me to even decide to go back to school. It had been 19 years since I had graduated from ICC, and raising kids and everything, procrastinating, did all that. My educator sent me a copy of her response, and I was so shocked by the words that she used to describe me. Like, she has a way with words, but it was all true, but I never had seen myself or thought of myself in the way that she responded. And because of that, it just kind of fueled me to keep going. And she knows that I often ask her, is there anything else I can do? Is there anything else I can be certified in? And because of this, she had prompted me to do a program with Methodist, and I was the first LPN to even complete this advancement program. And I was financially rewarded for completing it for 2 years. And because of this, she knew how excited I was to go back and to finally say that I was smart enough to pass as a registered nurse, because I had struggled with that before. So I thank you for your time. Have a good rest of the year.